name is Chris Yeckley, and I'm a registered nurse with the breast cancer surgical team here at the Swedish Cancer Institute. Today I'm going to talk with you about the care and management of your Jackson-Pratt drain, known commonly as a JP drain. You may have had this drain placed after your breast cancer surgery. I'm here today with Karen, and together we will discuss a JP drain. After our conversation, you will understand better what a JP drain is and how to care for it once you are home from the hospital. The JP drain is a wound drainage system that allows fluids to be removed from your surgical site. The drain is inserted during surgery to prevent a large collection of fluid under your skin. The JP drainage tubing coming from your incision area is connected to a small plastic suction bulb. This bulb is pinned to your hospital gown or clothing.
How does the JP drain work?
When the bulb is squeezed, it makes a suction that pulls extra fluid into the bulb.
When do I empty the bulb?
After surgery, the nurse will empty your drain in the hospital 3 times a day or as often as needed to keep the bulb less than 1/3 full. Sometimes you might see a blood clot in the tubing. This is normal. The nurse will show you how to milk or strip the tubing a few times a day to keep the tube open and working properly. At home, you will write down how much drainage you emptied over 1 day or 24 hours on a chart. We will go over this again in this podcast. Continue to empty your drain at least 3 times a day or more, if needed, to keep the bulb compressed and no more than 1/3 full.
How do I empty a JP drain?
First, wash your hands before emptying the drain. Milk or strip the tubing while the bulb is capped. Then open the plug attached to the top of the bulb. Pour the contents into a small measuring cup and write down the amount on your chart. Then, to start the suction, squeeze the bulb and cap the plug on the bulb while you are still squeezing it.
What should the drainage look like?
Over time, the amount of drainage is less and the color will slowly change from red to pink and then yellow and watery.
What should I do if my JP drain isn't working?
Check to see that the bulb is compressed, the plug is closed, there aren't any clots in the tubing, and finally try stripping the tubing a few times with the plug closed.
How do I care for the skin where the drain comes out?
You may shower with the drain in place and gently pat the area dry with a clean towel. If you notice a small amount of fluid that is leaked out around the drain, this is normal. Tape a clean gauze pad over the area where the drain comes out. Change the gauze at least once a day or more if needed.
What supplies will I need at home?
You'll need a measuring cup, some 2x2 gauze pads, and a 1-inch tape.
When should I call my doctor?
Call the doctor if the skin around the drain becomes red or swollen, more bleeding happens, or if there is yellow pus, a thick drainage coming from around your drain. Call your doctor if the drain tubing seems plugged up or no fluid is coming into the bulb, or if the bulb will not stay compressed. When the amount of drainage you empty over 1 or 2 days, 24 to 48 hours, is less than 30 milliliters or 1 ounce, make an appointment to have the drain removed. This is a copy of the JP drain recording sheet. On the back is a chart for you to record your output. At home, you'll also need some gauze and some tape. As mentioned, we want you to periodically milk, what we call milk or strip the line. There may be an occasional clot in the line that we want you to milk down to the bulb itself. When you open the JP drain, be aware not to touch in here so that you don't get any germs that travel in the bulb or up the line. You'll empty into the cup, and on the side of the cup it's scored with numbers 10 cc's, 20 cc's, and so on. You'll empty the cup then into down the drain and just rinse the cup out for reuse and record the drainage on the sheet, remembering to do a 24-hour total. In conclusion, here are some useful hints to remember when you have a JP drain. Make sure you empty the bulb at least 3 times a day or as needed. Do not allow it to get more than 1/3 full. Strip the JP drain tubing at least 3 times a day. Finally, call your doctor when the day's total amount from the drain is 30 cc's or less. If you follow these instructions, you should not have any problems with your JP drain. These hints are also written on the handout if you have any further questions or concerns. Please contact your physician or refer to the handout titled Swedish Nursing Services, Jackson Pratt JP Drain. Thank you for listening to the Plugged Into Your Health Cancer Podcast program.